Good morning, everybody. It's the CCO Contracts and Compliance Workgroup meeting for February 22nd. I'm Dave Inbody, I'm CCO Operations Manager, and have a number of things to cover today. Anne, can you show us the agenda? So we're going to start with a follow-up on the provider directory. We had a discussion of that at the Operations Collaborative meeting 2 weeks ago and a meeting in between, so I wanted to give you an update on that. Then Cheryl's going to spend some time giving you an update on the contract restatement process as we start to dive into that. Jane will give us an update on where we are with the language access template. And then might be going to the discussion of the 3046 mental health parity bill. I know that Nathan is double booked, so he might be joining us late, so we may have to push that until the end of the meeting, but either way, we'll make time to cover that. And then the bulk of the time we'll spend on the contract deliverables. We have a number of those that wanted to discuss, to talk about. But up front, first thing is I wanted to give you an update as it relates to the provider directory. The first thing is that it was 2 weeks ago at the Ops Collaborative meeting that we started the discussion, and the discussion being that there were challenges associated with that, some of the provider directory requirements, one particularly about the cultural competency training and identification of providers having done the training was brought up is that for most licensure and certifications, this is a requirement anyway. So is there a way for us to utilize the fact that that requirement exists and not necessarily have to re-verify with providers? So in our meeting last week, we had a meeting that included a number of CCOs. That was one of the points that was discussed, and we are currently in the process of examining which and how many of the licensure and certification are covered through that process, and to the degree we can, we want to use that as verification. So this would be one thing that you may not necessarily be able to or need to require of providers to information that providers would not need to provide, but we'll verify that once we get that completed, and hopefully we'll be able to move forward with that. The other was to what extent those providers that don't respond, how best to represent that, and to what extent the CCOs are responsible. We did have a discussion between our meetings with HSAG, and one of the suggestions that was made was the use of a missing or blank as an indication that there was no response from the provider, and HSAG indicated or verified that a CCO will not be cast negatively for providing that in that way. So basically what that means is if there's a provider that does not respond, that you can identify the information as missing, and that's acceptable in terms of your HSAG review. So that some progress there, and I think that's helpful. And then the third piece is recognizing that the underlying intent of the cultural competency training requirement in the provider directory was intended to express the degree, to allow members more insight into the cultural competency of a potential provider. And so as we talk through this, one of the things that was identified was the prospect of having brief narrative for a provider to voluntarily submit, which would provide any additional cultural competency background or some individual insight into that for that particular provider that may be helpful to a member to see. So those are some of the steps that we had originally identified and will continue to push forward with through this process, and hopefully we'll be able to get to a place of a much more valuable submission, as well as not being overly burdensome on places it doesn't need to be. But I do want to open it up to see if there was anyone else who had attended the meeting that may have comments or thoughts around the process or any of the considerations that came out of the meeting.
So Dave, this is Nancy Rickenbach from UHA, and I'm assuming that you've all spoken about the fact that House Bill 2011 adds to the cultural competency training for the licensing boards, so that this particular request is duplicative of those licensing boards already gathering that. Is that correct?
Yeah, that was one of the things that we identified through that process. You know, currently the request has been that you ask providers to verify that they've taken the training, and recognizing that boards and certifications are already requiring that training, it seems redundant. And so one thing that we're working through now is to ensure that all of the providers that are included in the directory fall into that category, and that we're not missing any. But yeah, that was one of the primary places where we felt like there was a need for a change.
Okay, great. Thank you.
Any other questions or comments on this? I think it was good progress.
Hi, Dave.
And oh, go ahead.
I was just going to say thank you, and I appreciate it. I think that pursuing these three, additions or modifications definitely get us a lot closer and address some of the issues we raised in the phone call. So I appreciate it, and would love to be kept posted on the progress about the crosswalk with medical board info. I know it'll take some time, so I'd appreciate getting updates.
Yeah, and I'll keep this as a standing item here as we work through it. So in case there's any places where we either run into issues, or just as you said, to provide ongoing updates, so you know where we are with the process. But yeah, I felt like it was a good engaged process that helped us get to a place where we need to be. Stick, did you have a question or comment?
Yeah, can you hear me? I'm logged in remotely, so I'm not sure if you can hear me.
Yeah, I can hear you.
Okay, good. No, my question was, and I apologize if this was discussed before I got on the call, but things like this, the more that we can build them into just standard operations, the better, right? You know, it's kind of the goal with equity anyways, is that we're improving the system throughout. And so I'm just wondering if there was any discussion with the advisory committee that oversees the state credentialing application to have this as an added field, so it's just standard across the board and submitted. So it's not a new piece of information that we're looking for, but something that's actually on that application, and then we can verify and check. And the more we have outside processes for verification, the more difficult that can be. And it would just make it a little easier if it was added there.
Yeah, it's a good point. I appreciate that. I'll make sure and add that to our list of considerations. Yeah, I think that was part of what came out of the discussion as well. Is there are a lot of places where information and we've kind of been going through this for a while on a number of deliverables. There's a number of places where the information we're seeking or requesting may already be available from other sources, and to the degree that that's possible, I think we should take full advantage of it. And I think this is one of those. So I do appreciate it as a way to add to that effort. So thank you. Any other thoughts? All right. Well, we can move on to the next item. I know that Cheryl is excited to share with you the 2023 CCO contract restatement process and get you a little more information on that. So I'll turn it over to Cheryl.
Thank you, Dave. Wow, you set the expectations high. So Anne is sharing on the screen right now the same document that we presented in the Ops Collaborative meeting a couple weeks back, and this has been shared directly with all the CCOs as well. So I want to use this as a reference point to show you where we are in the process in terms of the proposed significant changes coming from internally within OHA. So, and I apologize for the massiveness of this document. It's meant to be very comprehensive, but we're just going to focus in section 1 right here. So where we are today is the second row below section 1, where it says possible OHA discussion with CCOs about proposed significant changes if known by this date. And we can definitely send this document out to this group. It'll be duplicative for some folks, but the more the merrier. So where we are right now is we have just recently received from the internal OHA SME unit that are proposing significant changes for 2023, what their changes are. And so the internal process that we have is that those proposed changes, they first go to our internal body called C2M, or Changes to Medicaid, which is a high-level group of managers, some division heads, high-level policy analysts, where that group looks at the proposed changes and determines whether or not they'll actually proceed through the process of being considered. For those proposed changes that do get the green light, then there will be a subsequent presentation to CCOs. Most of those presentations will occur in either this meeting or an ops collaborative over the next month and a half. Ones that have a financial impact will occur in the rates work group meetings that are hosted by OAFA. So again, right now, we are just at the very start of that process. No decisions have been made, but once they get the green light, they get presented to CCOs, and then they come back to C2M following that CCO presentation for a final thumbs up or thumbs down for inclusion in the 23 contract. So what I want to share with you today is a high-level summary of those internally proposed significant changes that we've received. So these are going to start being reviewed by C2M, I think later this week, to determine whether or not they proceed. And again, the next step in that process is presentation to the CCOs for input and feedback. So we have quite a few so far. Now, again, super high level here. We have one of them that's about IIBHT, or in-home intensive behavioral health treatment. And this is around accountability, given that IIBHT was added to the CCO contract in 21. The cap rates were adjusted for that, but it's not quite happening as has been intended. So we're exploring some sort of accountability change in the contract. The next one is that we are going to add language requiring the CCO to ensure member access to treatment for co-occurring disorders through provider agencies that are certified for co-occurring disorders, as those provider agencies get that certification and come into existence in the CCO service areas. For some of these COA agencies, they actually may already exist as both outpatient mental health and outpatient SUD, but not yet having the co-occurring disorder specific certification. But that's what this other change is about requiring access to these certified providers as they come into existence in the CCO service area. Another proposed change is requiring the CCO to cover problem gambling treatment in outpatient and residential settings, which would mean, of course, that the CCO would need to contract with the provider agency certified for problem gambling treatment. And as a side note, I think many of you already know that this is covered to a degree, but it's done through lottery funds, and it isn't part of Medicaid services. This would actually put it into the contract as Medicaid services so that we can get a federal match. So that's one of the changes. I think those of you who have been involved on the dental side and potentially with OAFA will recognize this next one, which is effective 1/1/23. There is a new benefit for oral health being added to the prioritized list, which is handicapping malocclusion. And so the proposed contract change is to establish a risk corridor for this rather costly benefit. And speaking of risk corridors, we are looking to remove the CCO risk corridor for hepatitis C treatment medications. That's been in the contract for a long time, and the cost of the medications have decreased quite a bit since it was implemented. So we're looking at potentially removing the Hep C risk corridor from the contract. Another change is regarding out-of-hospital births, which is now referred to as community births or even planned community births. So currently, these services are carved out of the CCO contract, but a few CCOs have expressed interest in actually managing this for their CCO. So we're going to propose to include an option for a CCO to opt in to covering community births. So again, it's going to be optional, and so we'll have a particular date by which CCOs would have to give notice, and then they could then choose to be responsible for covering that rather than it being carved out. And let's see, another change is regarding EPSDT, and I always got to make sure I get that acronym right. So regarding EPSDT, that's the Early and Periodic Screening, Diagnostic, and Treatment Services, and it's for members through age 20. It's a massive federal requirement, and you'll recognize that we put a lot of content related to this in the 2022 contract. So the proposed changes would be to require CCO reporting on prior authorization denials, below the line claim denials, and to also report on those requirements we added in the 22 contract. And then there would also be a requirement for the CCO to implement an enhanced exceptions process for PA requests and to make sure that that meets the federal EPSDT requirements. Just a couple more to go, actually 3 more. So another proposed change is that we would require the CCO to do discharge planning for individuals who are in OSH, who are admitted under aid and assist and guilty except for insanity, in addition to the existing requirement to do this for individuals who are civilly committed. So again, that's another proposed change. This next one is actually already approved in the sense that executive leadership has already committed to our tribal partners that this will be implemented. And this is to require the CCOs to reimburse Indian healthcare providers at their applicable daily encounter rates, instead of what happens right now, which is the CCO pays the Indian healthcare providers claims, OHA does a supplemental payment to make up the difference to the federally required daily rate. So instead of having this sort of 2-part process, the CCO would just pay for the entire daily encounter rate at the front end with no more supplemental payment done by OHA. And another change, I think this is the last one, which is that the specific changes are not yet determined, but we're having a third party do an administrative expense study, and we expect that to result in some recommendations for the contract. So we don't actually have this in detail yet, but just a heads up that there's something potentially being proposed related to CCO's admin expenses. And as we have more information, we'll definitely tell you, but that's all I have for the moment. And I want to reiterate that these are proposed changes. They've not yet gone through our initial sort of readiness review process with C2M to determine if they will proceed. And I want to also explain that this C2M readiness process actually requires the subject matter expert or unit proposing the change to essentially confirm that they have something like a project plan for this. Like, for example, they consulted with OAFA regarding the financial impact. They consulted with our state plan manager, our waiver manager, to see if there's any implications for either of those. It involved them seeing whether or not rule changes might be implicated and having an idea when a RAC might happen. So essentially, we are requiring the responsible units to give a good sense that they have a project plan of sorts to bring this to completion and readiness by 1/1. But these are all still in the early proposed state haven't yet gone to C2M, and any of them that do pass that level will come back to CCOs for further discussion. And those discussions will happen in March and early April. So I'll stop there and take a drink of water and see what questions we have.
It looks like Michael has his hand up.
Yep, so Michael, please.
Yeah, sorry about that. And I appreciate you going through the process, Cheryl. I think it's good to have some transparency on it. In terms of the internal review process, OHA, you mentioned, are there a set of philosophies on what, or principles on what OHA is considering? And if so, can you share that? If not, or if it needs to be expanded, I would really advocate that we really take into consideration impact to the provider community, knowing that many of our providers are already strained due to ongoing COVID, and not to mention just it's dealing with Medicaid members is not always it requires often more work than the rest of the population. And so I would be curious to see what are the kind of the principles on some of these key changes coming through.
Thank you for asking that. And I actually do have information I can share on that, and we'll send that out after the meeting. And so I'm looking in the chat here. Let's see. So Laura, do we have an idea who will be assisting in implementing the ortho changes? Will there be rules? So I can't answer this level of detail yet, Laura, because we're at such a high level in our process, but I will see what I can find out and provide a response offline. I am confident that the internal parties responsible for this are aware of the interest by CCOs in these changes, but I will see what I can find out and provide a response offline. Let's see, Ann Ford.
And I was just going to say, add to that, Cheryl. The other thing to stress, and I think you've mentioned it, is our intention to bring all of these issues to this meeting or the Ops Collaborative meeting over the next few months. So we'll be able to dig into each of these much more deeply. The list that Cheryl gave you was kind of our initial list. And what we haven't done is a vetting through OHA leadership to see which ones they support moving forward with or not. The other part of this that we didn't touch on and we're currently in the process of doing is looking at those issues that were raised last year by CCOs that we weren't able to dig into fully last year, but may be able to bring back this year for review. So that's two categories that we still haven't completely gone through, but could potentially be part of these changes as well. So like I said, I think the big thing, and we'll try and give you advance notice of which topics we'll be covering at each upcoming meeting, so that we can ensure that the right people are at the meeting to be a part of that discussion.
Thanks for that, Dave. And so with that in mind, I would, to Ann Ford's question, talking about incentives or simplifying the process for COD certified agencies, I can't speak to that level of detail yet. That's much further along in the process. So the purpose today was simply to give a preview of these are what we've received so far as proposed changes. They've not yet been vetted through C2M leadership. So this is just a preview for y'all. And as Dave described, once they get thumbs up or thumbs down from C2M, then they'll be coming back to this group or to Ops Collaborative for an actual presentation where we can go deeper in the weeds on some of these questions. And let's see, Michael, let's see. Yeah, so good question. So Michael asked, will those future contract and compliance meetings include the OHA staff who are requesting those changes? Yes. In fact, that's the entire point, is that those individuals proposing the changes, they're essentially the subject matter experts, and they're the ones who would come to the CCO meeting to present on the change in more detail and to get CCO feedback on the changes. That's a requirement of the process. And like Dave alluded to, we will give advance notice to you all about which topic is being covered when, because then you can also have your internal subject matter experts prioritize attending that same meeting so that they can listen and contribute to the conversation.
Cheryl, it looks like Deanne has her hand up.
Yeah, I'm just looking at that. Please go ahead.
Hi, this is Deanne with YCCO. Just sort of a comment and then a question, and I think not even looking for a response, but maybe a request. You mentioned about making CCOs more accountable for IIBHT. And I think maybe my feedback, and hopefully something that might be considered when internal conversations are happening, is accountability, as it's been used recently, does seem a bit of shaming and blaming for things that maybe CCOs don't have control over, or insinuating that we're kind of slacking and not intentionally not being accountable for something. And I know that wasn't your intention, and I don't think it is OHA's intention, but it can, I think, bias conversations at times. So as for IIBHT, I would request that maybe things be considered in the context of the reality, which is for IIBHT, there's two challenges. One, we're in a major workforce crisis, and the CCOs aren't going to be able to magically solve that to, get more IIBHT providers credentialed. The other half of it is, and probably my question is, has there been any conversation about rewriting the IIBHT OARs prior to 2023, given that they tended to be a little more reflective of a metro or larger rural reality, and that some of the major challenges are indeed in these smaller rural and frontier counties, where to implement IIBHT to full OAR compliance would consume such a significant portion of their budget so as to not be able to provide the service. And even if the CCOs are providing them a full, $3,000 plus, dollars for each case per month, again, they don't have enough cases to actually support one. So that was long-winded, but there was, I think, two things we really need to embrace and contemplate as we move forward. Thank you.
Thank you, Deanne, for that. And I can definitely relate to being long-winded. I'm long-winded myself. I realize you didn't necessarily request a response, but I just want to acknowledge I do appreciate what you're saying about use of the term accountability and how that can have different and potentially complicated meanings and interpretations. So thank you for that. As far as your mention about IIBHT rules, that kind of that level of detail would be more appropriate when the subject matter expert comes to the CCO meeting and talks about this proposed change. So going into that level of detail, I think we can save for that future conversation. And it looks like, Michael, your hand is still up. Is that intentional?
No, it's not. I just like to draw attention to myself, so sorry about that.
Well, there you go. You got the whole meeting. And I think that there's no further questions right now. That's all from me.
Okay, thank you, Cheryl. I wanted to see, Anne, there was a question about the agenda. I wanted to see if you might be able to put the agenda in the chat so people can reference it. I don't think that we got it out prior to the meeting, unfortunately, but just to make sure that we are able to access that. Appreciate it. Did want to go to the next item. I think, oh, hi, Nathan. You're able to join us. We can either go, I don't know if you're ready to go now, Nathan, or if you want us to wait, but we had you on the agenda we're shifting you around, but if you're ready to go now, we can jump right into the mental health parity considerations.
Yeah, either way, I'm happy to go now. I'm happy to go as scheduled as well. So.
Okay, well, why don't we go to Nathan then? I'll turn it over to you. Thanks,
Appreciate
Nathan.
it. Thank you. All right, I see my slides and everything. Awesome. Yeah, so you are all probably aware that the last session, the 2021 legislative session, the House Bill 3046, changed the requirements for mental health parity. And so I wanted to give you an overview of what that is looking like and what to expect and what some asks of CCOs will be coming up. So in a nutshell, at least the half of the bill that deals with the Oregon Health Plan, it does have a whole other half that addressed private insurance, and I'm not speaking about that half today. But for our half, it did take the bill took what was previously, or what is the federal requirement for mental health parity assessments, and made them state law. And it set timelines in state law. So the parity assessment now with that OHA conducts needs to kick off in March. Data is due back from CCOs in June. And the final report is now due the end of December. Largely, it didn't change the assessment itself, but it did in my next slide, or my next bullet down. It did add some new areas of assessment that we haven't assessed before. So what that means for CCOs is the mental health parity assessment that you have now done a few years in a row now. That's going to look very similar, very much the same. Invite you all to join us for the technical assistance and kickoff for that, which is coming up, I believe, on the 10th. But you would have all been invited, I believe, or if you haven't, speak up and we'll get you invited for that. So that assessment, I'm previewing it just a little bit, but it's going to look highly similar to what CCOs have done in the past. And then the pieces that are new, the bill directs us to apply a parity analysis to network adequacy, to timely access, and to something that the bill calls services CCOs are not required to cover. So services that are requested of CCOs, but CCOs are not required to cover. And I'll speak a little bit about what our plans are for those new areas of assessment coming up shortly. Additionally, the bill adds in a requirement that we collaborate with CCOs, which we were doing somewhat already, and that we collaborate with behavioral health providers and consumers of behavioral health services. Those are our groups that we haven't in the past explicitly collaborated with on the assessment. So I'll speak a little bit about what that's going to look like. Let's see, and then additionally, I have offered the tribes of Oregon that if they would also like to collaborate with us, we would do that. And I just made that offer recently, so I haven't heard back whether they would also like to be a collaboration group, but we will welcome them if they wish. I think we can go to the next slide. Thank you. So the collaboration ask, again, this is in addition to what the main parity assessment, which I've already stated is going to look highly similar to what we have done in the past. We're looking at this as a continuous improvement. The statute makes it clear that this isn't a one-time collaboration. So we're looking at over time, annually working with the collaboration groups on the parity assessment. This year, we want to focus in the spring and early summer on the new requirements of the parity assessment, which I'm going to dive into just a little bit more what our initial thinking is in the next slide. But so early this year, looking at that network adequacy and services or timely access and services requested that CCOs are not required to cover. In future years, we intend to, oh, I'm not quite ready for the next slide, I'm sorry. Future years, we intend to hand over selecting a deep dive topic to the collaboration group. So CCOs will be part of the collaborators that will be selecting an area for a deep dive assessment. In the past, the state has reserved that for ourselves. We have said, well, you know, we're interested in doing a parity deep dive in a particular topic. And so our plan is after we get these new assessment requirements figured out, that future years we will empower the CCOs and the other collaborators together to direct us as to what area we should do a deeper dive in. We'll have to do the main parity assessment that's prescribed in law, and we won't be able to deviate too much from that. But the deep dive is an area that we can design, and so both in what the topic should be and sort of the design of how we should assess it, we intend to really lean on our collaborators to help us with that. And then, of course, every year after we get the assessment results back, which is June, then that fall, part of us assessing and determining if there will be any findings, understanding what those assessment results mean. There's going to be an opportunity for the CCOs and the other collaborator groups to help us make sense of and understand the data that we've collected. So at least engagement with CCOs around before the assessment around what the assessment will be, and then engagement after the results are back around what the results mean. For CCOs, that probably won't look highly different from the kinds of collaboration that we have done in the past ahead of publishing our final reports, where we give CCOs an opportunity to help us understand what those results mean. But it will be new to have other collaborators also contributing their input about the results. Let's see. So yeah, that's the kind of questions we'll be asking when we're seeking input. Yep. Okay. I think I covered everything on that slide. Next slide, please. So the new areas of assessment, which will be ongoing and forever required, but they're new this year. So particular focus on that, on what those will be. We've kind of grouped network adequacy and timely access together. Want to acknowledge that we already do a network adequacy assessment, that the details of that are something the state is working on this year, and this parity requirement is independent of that. So we will be also needing to ask the parity question, which is when it comes to network and the decisions CCOs are making about network and ensuring that the network is adequate. Is there any bias in there against behavioral health services and behavioral health providers? So that's the parity question. So in addition to the network adequacy criteria, that isn't the parity assessment, but will be done, we do need to be asking that question about bias. And so we will be giving you an opportunity to give us some input on how we might best assess that parity question for timely access and network adequacy. And then our thoughts on the other component, which is the services requested that CCOs are not required to cover. We believe that means claims when the denial reason is that's not a covered OHP covered benefit. I think we have data on that. We think it from encounters. We think it means prior authorizations when denial reason is also that's not a covered service. We may need to work with you on some data around that. I know we have some prior auth data, but I don't know if it's adequate for this question. So the discussions around what additional data might we need, right, are coming to you. That's we're going to try to use this year to get this figured out. What data can we collect? How's the best way to do it? Are there already data sources that we don't have to we can just tap and we don't have to burden CCOs with additional requirements? So this year is about figuring out those details. And then one that I know we'll have to dig into what other, how can we supplement the data that we already have is the health related services. I think we have some data on that around money. It's financial, I think, money that CCOs are spending, but we likely will need additional details in order to be able to apply a parity assessment to those. So discussions and ideas a request for your ideas and discussion coming on how we will do that. Our intention is that by the end of this year, by the final report, which is due in December, of this year, that we will be able to lay out, here is a solid assessment plan for 2023 to really properly assess these new areas of assessment. Next slide, please. Oh, was that it? Okay. Some links that to the House bill to where we have posted all of the past assessments. I believe I distributed a 5-year plan document to CCOs, but I can make sure that gets redistributed out. That shows basically what I went over in these slides, but just the activities for each year. And that is it for my presentation. Happy to field any questions if time allows or discussion.
Thanks, Nathan. Do we have any questions or comments for Nathan? Nathan, can you talk a little bit more about what that engagement, what you anticipate that engagement looking like over the course of the year? You had mentioned that the intent was to kind of arrive at a reporting structure for next year, as most notably as it relates to HRS. But can you talk a little bit more about what the CCO should anticipate over the course of the year?
Yeah. I'm happy to do that. And I will acknowledge that I've been working on a lot of other things, particularly just identifying who are going to be the other collaborator groups. With the CCOs, it's well defined, right? I know who the CCOs are, and Dave's got many meetings that I can pick from for this engagement and collaboration. Not so with the other groups that we're going to collaborate with. So I'm getting very close. I've already had some engagements and getting closer to that. But my intent is that the questions and the structure of that will be highly similar. That we will be. I'm intending to start a little broad and really allowing CCOs and the other collaborators to share worries, pain points, fears, that very broad hopes. What do we hope we can capture and learn? What would be useful? Then take it back, the state team work on, okay, how can we shape that into a reasonable assessment, coming back with proposals. Here's how we think we can evaluate these, avoiding some of the fears, digging into some of the pain points, and learning some of the things that you all have said you would like to learn. and getting your thoughts on our assessment plan. Is it reasonable? Is it going to get what we want? So some back and forth like that. I think much of it can be done where, there's a little presentation of it and more take this away, have your staff spend some time on it, give us feedback, is kind of the model that I'm hoping to use. Does that help, Dave? Does that answer enough?
Yeah, I think so. See if there's any additional questions or comments. All right. If not, I appreciate it, Nathan. I know we'll be hearing more about this over the course of the year. Oh, it looks like we do have a question in here from Jim. The question is, have you and your team been able to gather any information from other state programs regarding these new asks?
The DCPS has highly similar, if that's what you're referring to, highly similar requirements. They don't have I don't believe they have the collaboration requirement, but they do have to assess network adequacy. Yes, we are in discussions with DCPS about how they are tackling this, and we will continue to do that if that is who you're referring to.
I'm referring, yes, Nathan, this is Jim, and I'm just globally across the country. There are other programs that have wrestled with similar things. So rather than trying to reinvent the wheel, trying to find out how much, if any, there's lessons to be learned from other programs that are out there so we don't go down the same rabbit holes. And first and foremost, I will say thank you for the opportunity to continue to talk to you about this. We definitely want to be engaged 110%, if not 1,000 in this. But I do want to say that this is a great opportunity for us to remove the subjectivity out of these discussions as we go into the future and really get us to a point of universal agreement as far as what you all want versus what the CCOs can deliver versus what the definitions are that we're trying to resolve in these asks. And I'm super sensitive to that based off of the history of program being built to this point right now in its current state versus where we want to go in the future. So we could just get a couple of those things nailed down with universal acceptance saying OHA believes this means this. Then we have a foundation to deal with. Does that make sense?
It does. It does. Yeah. Yes. I really look forward to, hearing those things. These are pain points for us because they're not clear and we'd like to get them clearer, or and also look forward to this being a conversation over many seasons, many years. We will try to get it as perfect as we can this year, and we'll come back and try to get it more perfect next year. So yes, thank you. If you know of some states that have done this particularly well, I would welcome you forwarding those to me, and I can look into that. I haven't cast a net to really look across what other states are doing. So
thank you. Will do, and I'll keep my ears and eyes open for that stuff as well. Thanks, Nathan.
Yeah, thanks.
Any other questions for Nathan? If not, thank you, Nathan. Like I said, I appreciate it, and I know that we'll be talking more about this as the year goes on. So thanks for joining us.
Yeah.
Okay, our next item, we'll jump back and see if Jane Hannafah has an update for us regarding the language access template. Jane, do you have an update for us? And if you're trying to speak, you might be on mute. Not able to hear you. Okay, looks like Jane's working through some audio issues. Give her a minute, but I did want to queue up where we're headed next. We did want to touch on the CCO contract deliverables. We do have a discussion of the HSAG EQRO timeline. We'll spend a little bit of time on that. It's also some fraud, waste, and abuse questions about those deliverables. And then we'll try and save a little bit of time at the end in case for the open discussion. We'll try and see if we can go back to Jane, see if you are able to join us.
Can you hear me now?
Oh, there you go. I can hear you.
Okay, thanks. Sorry. So the interpreter vendor template, a group of us got together to see if we could create a common template that could be used across multiple vendors so that they weren't switching templates for each CCO, and that it contained all of the information that we needed for our reporting and tracking of interpreter services. We have developed a finalized or a draft final template, which we are trying to get people to beta test to make sure that we don't have any bugs in it, that it's easy to use, and that it's going to help in this space. I know Care Oregon has been looking at it. There may be a few others as well that are beta testing it. It is available if anybody doesn't have it and would like it. If they want to contact me, I'm happy to send it out. I think it's just about final, and so the group will meet again to make sure there are no other changes before sending it out. And then something came up during our meetings, and people were asking if we could possibly discuss how people are going to collect information from providers for the new requirements that are due regarding interpreter services and when they're rendered and if they're rendered. If anyone is interested in participating in those discussions, I think we were going to continue to meet and maybe get some input and discuss some of that as well as we go forward. We did have good participation, and I appreciate everybody's participation. We did have a number of meetings on this, and I know everybody's time is tied up and everybody's really busy. So I want to thank everybody. Stick, we asked the CCOs if any of them wanted to participate, and then we developed it based off of our requirements. We haven't. I'm getting an echo. We haven't sent it out to any vendors yet.
Yeah, I apologize. I don't know how I would have missed this, or maybe something didn't happen internally that it wasn't forwarded over. Just like you said, we're all incredibly busy. If you could send it over, I'd appreciate it. But also then the Healthcare Interpreter Council, I mean, that's a governing body, and it impacts interpreters. So I'm saying if it was discussed with them.
I think only the states and the state had representation in the work group, and then the CCOs had representation. That was how the group was developed. I'm happy to send it to you though. And it was based off of our requirements for the QIM measure. Anna, I see you would like it as well.
Yeah, I'd appreciate it, and just thank you for sending that. I just appreciate just a chance to take a look. We think of agencies and just making sure that there's a lot of independent interpreters out there, and if there's any way to make sure they're included in the discussion, and they definitely cover the gaps in our rural and frontier communities. So for those in-person services.
Jane, do you have thoughts on how we might be able to maybe take that as a future step? You know, as you mentioned,
Yeah.
we kind of started with the discussion with CCOs and OHA, but maybe the next step is how do we then bring this to the providers and see what may work best for them and how best to integrate them in this discussion?
Sure. I did. We can send the template out with the meeting agenda and other attachments because I did send it to you, Dave, or I can send it out individually. I think we will be having another meeting, so if people are interested in having people come to that meeting or want to share it and ask them to come, I'm happy to invite whomever. Monica, I see you have your hand up.
Yeah, I was wondering, Jane, if you think this group that is focused on this template and interpreter services might be a good group to continue on and potentially expand to address some of the translation challenges I know we've talked about in this group. I think not last time, but the time before. And I think the meeting ended with Veronica saying, oh, do we want to get together and work on that? So it's just a curiosity. I know you have, you still have work to do. So I'm not sure if it should be, a separate group, but it strikes me that probably the same folks are involved in the group that would also want to work on the translation activities as well.
Sure.
What do you think?
I mean, we could bring it up at that and see who would like to continue to participate. I'm happy to continue to facilitate that if it's helpful. We are sharing a copy of the template on the screen now. What we did is we tried to make it easy to use for the vendors that are sending information to the CCOs. There's a lot of drop downs. We've put language codes in so that they're easy to find and they do crosswalk to some of the reporting that we do. It was an attempt to make things easier for everyone. We put in some definitions. There's a little bit more of an explanation on some things. As you can see, the third page, these are all things that are crosswalked into the second page of the template, second tab. If you look at the second tab. So we've tried to crosswalk things to make it easy to use. But I'm happy to send this out and would love input and suggestions. We weren't trying to be exclusionary. I'm sorry if people didn't know it was happening.
Yeah, it looks like we have a lot of people interested, so we'll make sure that we get this distributed. I'm encouraged by the prospect of potentially using this group not only for the language access template, but also to start exploring the translation issues as well. Anna, it looks like you have a question or a comment.
Yeah, thank you. I wanted to bring it back a little bit to what Stick brought up, and something that we've just barely touched upon in that smaller group is the template, again, like Jane said, is hoping to make reporting more consistent and a little easier. And I do think that there's still some work to be done to say, are there opportunities to streamline how we collect this data and get it out of Excel sheets? And how do we kind of, as a group, support moving to a more efficient reporting system? Stick and I talked about this a little bit in a different context yesterday. All Care does at least some of theirs through a somewhat claims-based system. And so I think, it's here's all of the fields that we need, but how do we get them out of Excel is still kind of work to be done for sure.
And when
Agreed.
you say getting it out of Excel, are you talking about information you're receiving from the provider, or can you help explain that a little bit more?
Yeah, sure. I mean, get it in a way other than Excel from our vendors or from the interpreters themselves.
Yeah, so maybe
Anna,
it's more than. I'm sorry. Go ahead, Stick.
Well, I was gonna say, Anna, if you'd like me to elaborate more, I'm happy to kind of clarify.
Yeah, thanks, Dick. Yeah.
So Dave, the way we do this is it's a patchwork due to the fact that we have so regionally, and JCC works with us greatly with our Regional Health Equity Coalition down here. In-person interpretation really is the priority and the standard and the goal. That's what our community has asked for. So there's a patchwork of in-person interpretation that occurs across Southern Oregon. For those interpreters, so these are certified or qualified individuals that work for a provider's office, they actually have an MPI number and it's billed through the claims system, and all the information is gathered that way. So there would be no need for a spreadsheet. We're actually crosswalking from claims data to a spreadsheet. We also have some other independent folks that bill in that way also. And like I said, just kind of a patchwork of how those services are done and work throughout the system. And again, I can't stress enough that I understand the barriers related to Medicare and the waiver and Medicaid, but if interpreters would be able to utilize their license number as essentially a Medicaid ID number, you all could just get this through the encounter system. I'm not saying that's the best process. There's agencies that would have difficulty with that and onboarding, but making it a claims related activity gets you all the data that you would need essentially, and is one way we've approached this.
Do you have a sense of how much of the interpreters that you work with fall into that category, or what the distinction, how much of a distinction there is?
In our region, because of the lack of services, essentially the strategy has been to partner with clinics that have bilingual staff and then train them to become interpreters essentially for when they can do direct service at any time. But then when a provider steps in the room, they usually this is your MA or receptionist, and this is a skill, right? There's a licensure associated to it. But there's at least 300 interpreters, in Southern Oregon that are, I would say 3/4 of them are working in that way. And then we also, instead of, a lot of this also adds into the quality or incentive payments that we do carve outs specific to these services. So the provider's office gets reimbursement to then do pay differentials for those staff. Some systems do bonuses based upon the number of encounters they have. Some of them just do a straight $2 more an hour, or then 50 cents once you become qualified or certified, and we stratify our payment in that way. But the majority of our services are done in that way. One, it's far more cost effective, but two, the quality of service is much more preferred by all of our communities. The one barrier to that strategy, though, is ASL, is you're not going to have as many individuals that are proficient in that way and typically working as interpreters. And that's where I believe the agency strategy really comes in. But for your spoken languages, a lot of, we're talking about, this is a workforce diversity issue also, right? We're focusing on that and making sure that we're incentivizing staff for basically being two people, right? That they're either the MA and then also the interpreter at the same time. And a lot of times you also have translations that are occurring by those staff, and we also test for them in their written language proficiency and provide certifications with that. So like I said, integrating it more is better. Pulling it out separately makes it more difficult and is more of a burden on our providers and our interpreters.
I think there is still a very large issue, Dave, though, with getting enough qualified and certified interpreters across the state. I know we have a lot of barriers in that space that we're trying to overcome through various initiatives.
I appreciate that, Jane. I'm wondering if, do you feel like the group that you pulled together, and sounds like others are interested in joining or participating, do you think that that might be a good place to bring some of these questions moving forward? Do you feel like that's a group that would make sense to start to work through some of these?
I think with the addition of the others that have asked to be included, I think we could give it a go and see how it goes and bring it back to this group.
Yeah, and I guess let me know if there are OHA resources that are needed to support that, because I think this is a topic, and we've seen just through this discussion, there's a variety of different components of this topic that are worth exploring, and so I do want to support that.
I will do that. I'm going to put my email address in the chat if others want to just send me an email.
Yeah, that would be great. I appreciate it, Jane.
No problem. Thanks, everybody. Dave, I do have to drop. So the other item that I'm on, Tara is on from Pacific Source and may be able to speak to that.
Okay,
I apologize.
great.
I have a conflict.
That's okay. I appreciate it.
Thank you, everybody.
Can go to the next item, which relates to CCO deliverables relating to the HSAG EQRO timeline. And I'll turn it over to Carrie Williamson and Tiffany Reagan.
Good morning. I have a quick slide presentation. Allow me to share my screen and we'll go through that. And then being mindful of the time and knowing that there are other agenda items, wanting to present this morning some new updates and reiterate some previously provided updates regarding the EQR activities. Okay. I'm sharing my screen. Okay, are you all able to see that?
Yes. Yes.
Excellent. Excellent. Thank you. Thank you. Okay. So update to the 2022 CMR. This has previously been communicated, but just wanted to reiterate that the end date for submission for CCO documentation has been extended to April 28th of 2022. So that was moved up from, or moved back from March, I believe. So, so that will allow more time to navigate, other things that are due in between. And then the program integrity standard has been removed from the 2022 CMR. So I think Jamie Letter from HSAG had sent an email out last week, perhaps, regarding an updated CMR form. So please review that email on how to navigate completing the CMR template. But program integrity off the table for the 2022 CMR. Is it going to allow me to page further? There we go. And then wanted to provide an update on the work that we're doing around the statute 414.595 around documentation that OHA has received from the CCOs as it relates to EQR activities. So we are in the process internally of developing kind of a protocol around how we're going to handle that. We have been in communication with DOJ to make sure that that is compliant with the revised statute. So we are going to be sending some communication out to all of you ahead of the March 8th CCO operations meeting. So we're going to outline our proposed process, and then that will allow time for discussion at that 3/8 meeting, so that there will still be plenty of time for documentation submission. And then we really want to reiterate on our side that for that CMR process, it's really the CCO's ultimate responsibility to make sure that HSAG has received all the necessary documentation for that CMR review. And we'll talk about that more at 3/8, and we'll outline that more in our process. But that could include submitting duplicative information. So even if OHA is submitting something, it might be in your best interest to submit that as well. Just just to be darn sure that HSAG is reviewing exactly what you want them to be reviewing. And then an update on other activities, no changes at this point in time for timelines for CCOs as it relates to EDV, that DSN narrative reporting, mental health parity, which Nathan touched on earlier. No changes regarding the mental health service access monitoring PIP. And then there will be communication coming in March, potentially at the March QHawk meeting around the SUD PIP timelines. So be on the lookout for those. And like I said, that was a quick update. Any questions about any of that?
Don't see any questions.
All right. Please don't hesitate to reach out if you have any questions that pop up. And yes, be on the lookout for that memo from OHA regarding the revised statute and the documentation submission process on the OHA side. All right.
Great. Thank you, Carrie. Appreciate it. And we'll see you on the 8th. Okay. Next item we have, and it sounds like Tara, you may be able to be working through this in Jane's stead. Whereas a couple of issues that were raised regarding the fraud, waste, and abuse deliverables. I'd like to start that discussion. We have about 10 minutes, so I don't know which parts you want to go through, but I think maybe talking through some of the issues and some of the recommendations, I'd be interested to hear feedback from the group about whether they feel like these approaches are moving in the right direction or is where we want to go. And if you could put the recommendations back up. See if Tara's with us. Did you want to?
Yes, I'm here.
I don't know if you want to talk to Great.
Thank you. I actually met with Jessica Sayers internally at Pacific Source, just a little bit of background, and shared with her some of the struggles or kind of barriers that I was running into when I'm the owner of the kind of bringing all of the FWA deliverables together into a package to submit to OHA. And she had recommended that I kind of document like what issues am I seeing and what's an example and what could I do or what could I recommend we do to alleviate that so that I kind of come up with a solution to my problem. And so that's sort of what this list is, that I tried to outline kind of the general issue that I was seeing, and then kind of an example of where I saw this. And every single one, it has a different type of impact. Like all of them together is what kind of makes it difficult. Any one piece of it probably isn't a deal breaker or something that we have to do, but that's sort of kind of the background of where this came from. So the first issue was the contract doesn't capture or include a complete list of deliverables needing to be submitted. This is referring to the FWA deliverables template that we have to kind of complete for OPI. And it's not listed in the deliverables matrix. So when we prep it and pull it all together, there isn't really a checkbox or something that says, hey, make sure you fill out the template and include it with all of your other reporting annually. So that's what that one is specifically about. And so that was something we recommended, is just adding to the contract to say all of this needs to be included with the template that is posted to OHA's website. I don't know if, should I just keep going?
Yeah, maybe just walk through all of the
Okay.
issues and then then we'll see if there's any questions.
Okay, so number 2 was about the naming conventions differing between documents. So when the FWA deliverable template is posted out on OHA's contract site, it has a name of FWA deliverables template or something along those lines. But when you open it, it says program integrity review, and it makes it challenging to reference that document in emails or whatnot, because some people might be looking at the actual content within the document versus how it's named or the naming convention out on the site. So I recommended there just be kind of a one-to-one match, that we refer to it as like one kind of document and just consistently use that same naming convention. That could be done by renaming it on the website, which seems like that wouldn't be the best one because it currently falls in alphabetical order. So the alternative is updating the document itself, like within, having it say FWA deliverables template instead of program integrity review. If you want to keep scrolling down, that was number 2. Number 3 is the FWA deliverable template appears to require documentation above and beyond the CCO contract requirements. I found that when I get a copy of the template, I'm having to review it in its entirety and then having to compare it to what's in the CCO contract in order to ensure I'm not missing anything. Because if I were to just create the template or the reporting based on what it says in the contract, I would miss things, or I would get a finding back from OPI saying, hey, you didn't include this other piece. And an example of that was in the template, there's a kind of a narrative or a note that they add to each section that says, make sure your policies and procedures demonstrate that the CCO has developed and maintains an internal process for collecting this data and reporting it to OHA timely, which is fine. However, the note is made in a section that's supposed to be about the FWA handbook, and the handbook doesn't require that additional information. So I think that's where there's inconsistencies, and that they're wanting a little bit more, which is still something that we should be doing. However, the deliverable itself probably shouldn't include that, or it should be waiting until the program integrity review every 3 years by HSAG or something, or the contract needs to be updated to say that this is the expectation that we also need to include in our handbook procedures that show our collecting and data reporting timely. That's 4. 5. So that on 4, I included 2 different examples because it's not just about the handbook. There's other examples where there's extra notes. So that's why 4 was a little bit longer. 5, the feedback received from OHA's OPI requires documentation above and beyond what the CCO contract or FWA deliverable template requires. In our feedback that we received last year, we got a lot of feedback about things that we hadn't anticipated because we considered that we met the letter of the requirement. So for instance, it says that we need to identify the compliance committee, or make sure that we have the compliance committee identified. And we did that and said who all was in there, but we didn't list specific names, but we got a finding saying we have to include the specific names of members, but we can't find anything that says that that's what we're supposed to do. So again, it's more like we just want more transparency, and that if that's the intention, then we'd like that to be set up front so that we aren't spending so much time on the back end of trying to retrace our steps to figure out where did we pull the information, what was the requirement, because we do a lot of that in preparation for this deliverable. And it would just, to get a finding, it has this preconceived notion of you did something wrong. And because we do so much to prep for this and implement all of the different requirements, it feels like even if it could be said in observation, or could we see something different, I think is another thing that we could do instead of it being classified as a finding, because there isn't, it's more like the reviewer's interpretation of what they're looking for and not a specific issue that we have a gap. Like if we didn't talk about compliance committee at all, that would be considered a gap from my perspective. So the recommendation would be that maybe OPI reviews some of those findings prior to them going out the door. I know when I first started auditing, that was something where if I found something that I felt like was wrong, and reviewed it with my leadership, they would say, no, technically that meets the rule. So that was kind of the feedback, is maybe having kind of someone double check or review the findings, potential findings, before they are sent on to the CCO to make sure that OHA is in complete agreement with that being an actual not meeting the CFR or CCO contract. And so I give a couple of examples there. Is there anything after 5? I can't remember. No, that's it. So I'll open up questions, comments.
Yeah, Tara, I appreciate that. I think that I like the way that you've laid this out, not only explaining the issue, but possible approaches on how to improve it. And I think it's a good basis that we can work through. But I am interested to see, we have a couple of comments in the chat, but wanted to see if there are any other comments in the last few minutes we have here. Because what I'd like to do is use this as the basis of the discussion of this moving forward, if others are in agreement with that. Looks like Cynthia, you have your hand up?
Yes, I do, and I'm okay. I'm not echoing. That's a good thing. No, I agree, Tara. This is what we. This is the feedback that we provided last year. It was not. We found that the findings were not findings in relation to a CFR or an Oregon rule or the contract. It was more. We just thought it was more of a recommendation. Because like you, we had what was required in federal and state rule. So I agree with you, and I appreciate you laying it out like this as well. I wasn't that organized, but I would really appreciate if this was looked at from OPI, and the spirit that Tara has brought it forth. I just hope people look at it.
Thank you. I appreciate
Cynthia.
that, Cynthia. And I will say that I think this could also be the basis we can use for some discussions around the contract changes as well, because I think there are some references here as well in that direction. So. Yeah, and Monica had asked that I expand a little more on how to use this. I think there's two particular things. One is specifically in communicating these items to OPI. Like I said, I think the way that this is laid out is very helpful in allowing for it to be very clear what the issues are and what suggested changes are. And then the second is, as we go through the contract restatement discussions, identifying those places, because I know this is one of the areas that we didn't get to go into full detail last year. We had some discussions about this work, but I don't think we took it as far as we probably need to. And so I think this is one of those areas that would be an area of focus for this coming year as well. So I think that that's the other place, whether that be in this meeting or the Ops Collaborative meeting, in the discussion of potential contract changes would also be another place. We're down to our last few minutes. I don't know if you wanted to close with anything here, Tara. I do really appreciate the work that you've done on this. I think this is going to be really helpful for the discussion moving forward.
No, I think the only thing that isn't captured here is that it would be really great if OPI could come to this meeting and being willing to kind of engage, because I do think reading it is a little bit different than hearing our tone. That I'm not angry or I'm not accusatory. I don't think it's all on them, but I think that just to collaborate and to have a discussion about how it feels from the CCO's perspective. To see if we can kind of come together and make some changes.
Yeah, I do appreciate that. We have shared the invitation to join us here, and we'll continue to do that. So I appreciate it. All right. with that, thank you, everybody. And we'll be sure and get the documents that were shared here out to all of you if you haven't already. And we'll see you again soon. Thank you for all your work. Take care.